Hey guys, it's Amy Jordan here at Amy Jordan Speaks, and thanks for tuning in for our National Diabetes Awareness Month. We are discussing everything diabetes from diet to dating. I'm super excited to have my doctor and friend, Dr. HoomanYaghoobzadeh, here today. He is amazing, and I want to make sure I get this right. You are Associate Professor of Medicine at Weill, Cornell,
Yes,
and a fellow at
the American College of Cardiology.
Okay, good. He's a cardiologist extraordinaire in internal medicine and a very holistic human being, and I wanted to just have a chat with him about everything diabetes. So,
But no dating questions, right?
Sure.
You said everything from diabetes to dating. I'm not going to answer any dating questions.
Okay. Thank you. I don't know. That's a whole other karmic thing with me, but that's for another doctor.
That's for me to ask you.
You are the only doctor that asked me about that. And right now I don't have any information, but if I do, you'll be the first. You're invited to whatever foreseeable. I don't know. Okay. So, I just want to kind of know from you, you're so much about diabetes. I'm sure you see it a lot in your practice, like patients who come to you, what are your top recommendations or thoughts on not just surviving, but thriving with diabetes and how to deal with or prevent complication?
Yeah, it's, the folks who have been dealing with diabetes have been dealing with it for quite a long time. And it's one of those diseases where it's not just a medication, it's not just exercise, it's not just food and diet, it's not just stress levels and stress management. All of those things are relevant. So when we talk about lifestyle modification, this is like a perfect disease model where any and all, you have to really be and become the treatment, and to be able to get away from the disease. And so if you take your medicines but you're not eating well, or if you're eating well but not doing the right stuff with your medicines, the same with exercise. If you're doing all those things but stress and stress management is problematic and cortisol levels are through the roof. So, I try to sort of figure out how to get my patients to partner in the treatment course and really own, what they're going to do with it.
Behavior modification.
Yeah, it can go a long way. I mean, I particularly believe that dietary modification can go a very, very long way. And it's also not a one-size-fits-all kind of model. There are folks who are, very, very carb sensitive, and cutting down carbohydrates has to be, part and parcel of the issue. There are some folks, specifically type 2 diabetics, that have an inflammatory kind of underpinning in their disease process. And in addition to cutting out simple carbohydrates, increasing fiber is very, very important for them, and getting good gut health and reducing saturated fat and its roles in inflammation. So, especially these days with the continuous glucose monitors, it's magic. It's really such an amazing thing. I know. Don't you? Do you have a name for yours?
Suzette. Of course I have a name. I name everything. I named all, this.
Yeah, exactly. I'm sure you have a name.
She goes on. I'm like, shut up, Suzette.
Yeah.
I talk to her.
So I encourage patients to use it and figure out, what are the foods. Sometimes, one person will have steel cut oatmeal and it has this effect on their blood sugars, and somebody else completely different. So they can experiment with that in real time and get feedback right away. And that really helps behavior modification, obviously.
Thank you for saying that, because we talk a lot about figuring out what works, and it gets put in this box of do this, and
Yeah,
I am very sensitive to carbohydrates. Someone else might not be, but I've figured that out, so then I
yeah.
can fight around it. So I appreciate that very much in Diabetes Sanity, because it's a lot every day. Talking about the food, like what about the marketing problem of